Go.
Hey everyone, my name's Tia and I'm here with Paulo and Kendra. And for our project, we're focusing on catheter associated urinary tract infections or CAUTIs for a root cause analysis. Let's take a quick look at Silver Cross Hospital in New Lenox, Illinois. The surgical care unit is among 348 beds and is a level 2 trauma center. Their mission is to enhance community health and to promote overall wellness, while their vision focuses on creating a culture of excellence. Notably, they're ranked number 1 for surgical care in Illinois, and they maintain a staffing ratio of 4-1. We're facing an important issue in the SCU with 3 reported cases of CAUTIs in just the past 2 weeks. The first case is a 74-year-old female who had a cholecystectomy and a Foley catheter placed due to limited mobility. On post-op day 2, she showed signs of infection, including burning pain, but it was overlooked. By day 5, she presented with fever and fatigue, leading to a diagnosis of a CAUTI.
In case two is an 82-year-old female who has a hip replacement surgery. A Foley catheter was inserted preoperatively. 2 days post-op, the patient began having confusion, but it was attributed to the patient's age and post-op status. On day 4, the patient was experiencing signs of infection with more confusion. The urine in the bag appeared to be cloudy and foul smelling. The urinalysis and blood work showed that there was an infection related to CAUTI.
Case 3 is a 65-year-old obese patient admitted to SCU following bilateral knee replacements. He was placed on 48 hours bed rest, encouraged light activity. Vitals are within normal range. 48 hours after surgery, patient is complaining of 8 out of 10 pain, is bedridden, and cannot perform any light activities. Provider was notified and order was placed for increased pain medication and Foley catheter. Day 5 post-op, patient still unable to ambulate, is now complaining of feeling fatigued and chilly. Urine has strong foul odor and cloudy. Vitals are elevated with temperature of 101. Urinalysis and CBC was ordered. Urine came back positive for nitrites, leukocytes, and bacteria. Blood work came back with elevated WBC. Patient diagnosed with CAUTI, and antibiotics were prescribed along with a new Foley catheter.
Step 1 is significant risk to patients who have CAUTI. It could have led to urosepsis. A risk to a patient would have been a prolonged stay to further treatment and monitoring and a delayed recovery from the initial surgery due to the infection. The things that needed to be done immediately is to remove the urinary catheter and administer broad spectrum antibiotics.
Roles of multidisciplinary team. The multidisciplinary team plays a role in managing CAUTIs, with nurses monitoring patients and providing education, physicians diagnosing and prescribing treatment, infection control specialists implementing protocols, pharmacists advising on antibiotics, physical therapists promoting mobility, and nutritionists ensuring proper dietary support for healing. Additionally, diagnostic tests like X-ray and lab work are essential for assessing recovery and identifying any infections or abnormalities.
For case 1, the Foley catheter was inserted post-surgically, and then by day 3, the patient reported burning pain, but no intervention was taken, so symptoms worsened by day 5. The contributing factors included delayed recognition of infection signs and reliance on assumptions that the post-op pain was normal.
For case 2, a Foley catheter was inserted preoperatively on day 1. Day 2, the patient was showing confusion but attributed to the patient's age and post-op status. By day 4, the patient's infection symptoms worsened. The contributing factors would be that there was a delay in recognizing the signs of infection, cognitive impairment masked the infection symptoms, and the staff relied on assumptions.
For case 3, surgery was performed to both knees. Pain level post-surgery prevented patient from performing light activities. Provider ordered Foley catheter to be placed. His obesity could be the cause of him not being able to bear any weight. Assumptions that the reasons he had CAUTI: improper insertion of his Foley, infrequent urine emptying, and improper Foley tube cleaning.
Step 4, the causal factors is a delay in addressing early signs of infection to allow CAUTI to develop, inadequate catheter care and monitoring, and increased vulnerability due to patient's age. If these were eliminated, the event would have been less severe. The things that normally prevent CAUTI from happening would be a proper adherence to catheter care protocols, timely urine assessments, and early reporting of symptoms.
We created a fishbone diagram to analyze the causes, and key areas of concern include catheter management, increased catheter care in certain units, inadequate process for insertion and catheter care, and patient-related factors such as pre-existing conditions and limited mobility. And then for case 1, the 5 whys starts off with, why did the patient develop a CAUTI? Because the Foley catheter was left in despite symptoms of infection. Why? There was no intervention made because the symptoms were mistaken for post-surgical discomfort. Why? There was a failure to conduct proper assessments like labs early on. Why was that? Because the staff did not follow protocols, and that is because the team may have not received proper education about infection prevention.
For case 2, why did the patient develop CAUTI? The urinary catheter was in place for too long. Why? The nurse did not reassess regularly. Why? The patient's confusion made it difficult for the staff to gauge urinary needs and symptoms. Why? There was a lack of clear communication among healthcare team regarding the patient's cognitive status and potential infection signs. Why was there a lack of clear communication? The facility did not have standardized protocols.
For case 3, why did the patient get CAUTI? The urinary bags not emptied often enough. Why? The unit short-staffed with 1 nurse and 1 UAP per 4 patients. Why? Management can't fill the position due to the amount of work and working conditions. Prospective employees do not want that. Why? Nurse-to-patient ratio of 4:1 is overwhelming. And why can't the ratio be lowered? Hospital budget. And root cause statement. We got failure to adhere to catheter management policies and failure to intervene due to delayed recognition of infection signs. Step 5, action plan, interactive learning modules, and establish clear protocols.
The first ethical issue is non-maleficence, as our assumptions and inconsistencies in care delayed the recognition of an infection. And the second issue is justice, and it demands that all patients receive equitable care. In these cases, the misinterpreted of CAUTI symptoms to post-surgical recovery highlights disparities in care quality. Thank you for listening.